Hi everyone, this is Reassure and today I'm here with Reassure. So we are from LangFort International Academy. So we are back with another role play, and for today we have picked a very interesting topic. So it is one of the exam model cue cards. Here the patient underwent an emergency surgery for strangulated hernia, and the patient has a possible infection. So he's really worried whether it is going to be complicated or not. So the nurse has to handle the situation, explain the possibilities of the infection, and handle the patient here. So Dhanushya will be the patient and I'll be handling the part of the nurse. So let's get started.
LangFort International Academy. Your passport to the world of opportunities.
This is your cue card.
Thank
And
you.
you have 3 minutes to prepare.
All right.
Are you ready?
Yes. So how may I address you in the role play?
You can call me Susan.
All right.
Well, your time starts now.
Well, Miss Susan, thank you very much for your cooperation. I had a thorough look at the wound. Before we get into any further discussion, I would like to ask you some questions to get a clear understanding about the situation. So if you don't mind, can I ask you some questions?
Sure.
So you mentioned about the pain. Can you be more precise about when exactly it started?
Everything was quite normal for the first 2 days after I got discharged from the hospital. But the pain got worse since yesterday evening, and I have it all the time now.
Okay, so from what you told me, I understand that you have a constant pain.
Yeah.
So did you notice any other symptoms like fever or nausea, anything like that?
I feel a little bit hot now, but I'm not sick and I don't have any other symptoms either.
All right, okay. So I would also like to know about the wound care because we have instructed you about taking care of the wound. So can you tell me how you managed it?
I followed all the instructions given to me from the hospital very clearly and carefully.
So I assume you kept the wound dry and you also did the dressing properly, yeah?
Yes.
So did you by chance use any creams because the doctor instructed you not to use any creams as well? So
No, not at all.
All right, okay. So thank you very much for answering all my questions. So just to make sure that I've got all the information correctly, I'm just going to reiterate it back to you. So you started experiencing this pain yesterday evening and it is constant. You don't have any other symptoms, right?
Yes.
You just feel a little hot. And you took really good care of the wound as well.
Yeah.
All right, okay. So, I had an examination as I told you, and in my examination, I could see that you have pus and redness in the wound area, which indicate a possible infection. I know you are a little alarmed about it, but there is nothing to be concerned about, okay? I'll explain what we are going to do next. So we will take a wound swab and it will be assessed by the doctor and he will decide on the appropriate treatment for you. Will that be okay with you?
Okay, but I don't really understand how the wound could have got infected even after taking proper care.
Well, that's a reasonable query. I understand that you're really confused by how you got this infection even after taking care of the wound carefully. Miss Susan, there are possibilities, and even if you take really good care of the wound, there are possibilities bacteria might enter the wound and cause this infection. However, there is nothing for you to be alarmed about because this is quite harmless and we will take really good care of you. Okay, and I reassure you that since we could figure it out really early, we can treat it also properly. Okay. However, the important thing that you need to keep in mind is that you need to seek medical attention if you notice any changes or if you come across any discomforts like you have increased temperature or if you constantly feel nauseated, then yes, you need to seek medical attention. Okay, so I hope you will keep that in mind.
I think I don't have to get admitted to the hospital again.
Well, I understand it can be a little hectic thinking about a hospital admission. You won't need another hospital admission provided you take really good care of the wound and you need to come for the appointments on every alternate days as well. And if you take care of the wounds by following all the instructions we have provided you, then I don't think you need another hospital admission. Okay, so please don't worry about it.
Okay.
For the time being, you need to wait here to see the doctor because he need to have a quick assessment of you. So will that be okay?
Yeah, that's okay. But nurse, my son is waiting for me outside. I'd like to know how long I'll have to wait to meet the doctor so that I can let him know the exact time.
Well, I'm afraid I won't be able to tell you the exact time frame here. You know, this is a very busy clinic and we don't have enough staff also. The doctor availability is also limited. However, I sure it won't take much time. So if you can wait here for a couple of minutes, I can let you know when the doctor will be here. In the meantime, you can also let your son know that it might take some time. Okay?
Okay, well, in that case, I'll let him know that it might take some time and I'll return to the waiting area right after that.
I appreciate your patience, so I will let you know when the doctor is here. Thank you very much for your cooperation.
Okay. So this is the end of the role play.
All right. Yes, so we had just watched a role play where we handled a patient who was really concerned about the possible infection, and I hope the nurse was able to convince the patient and give measures about what can be done. So this was one of the exam model cue cards, and yes, we are seeing this as a trend. We are getting a lot of cards where we have to give instructions to the patient. It might be pre-operative or post-operative or post-discharge care. So you need to practice cards like this as well. So I hope this was helpful for you guys. Let us know in the comment section because we definitely get encouraged by seeing those comments. So we will see you guys very soon. Until then, take care. Bye-bye.
Bye.